Are we live?
Yes.
There's some pop-up here. Okay.
Yeah.
So, should we start now?
Yes.
So, a very good evening to you all the people tuning in to this first Facebook Live for Apollo Excelcare Hospital, and we are glad to be live on this special day of which is being celebrated as a World Kidney Day 2022. The theme for this day is kidney health for all, to bridge the knowledge gap to improve the kidney care. So this day is celebrated every year with a different theme, keeping in mind how to improve patient knowledge, how we can make patients aware, or how we can make the community aware about how kidney diseases happen, what are the symptoms of kidney disease, and this is just a day to remind everybody that how important kidney health is for a person and how long we can go if we focus on prevention rather than treatment. So the theme this year is kidney health for all, which essentially means that for all people, regardless of whether they are patients or just normal human beings like us, how we can improve our knowledge about the basic functioning of kidney so that we can take appropriate steps and prevent kidney diseases from happening. So I'll start this session. I'll be taking questions from the audience as and when they pop up on the screen, and my friend here will be helping me for that. What I'll do is I'll start off with some basic interesting facts about kidney diseases. Kidneys are this beautiful organ in our body, and then talk a little bit about how kidneys function, what are the basic functions of a normal kidney, what are the signs and symptoms, how to prevent your kidney, how to identify that you have a kidney problem. Once the kidney problem is identified, what we can do, and some basic myths about diets in kidney disease, what patients should be eating, what should not be eating, and then I'll take some questions. So kidneys are basically organs. We have two kidneys in our body, and the average size of the kidney is about the size of our fist. So this is our average size of the kidney. The kidney weighs around 150 grams only. So if you compare to our whole body, the weight, if suppose somebody is 60 kg, only 150 grams, that is less than 0.5% of the weight is kidneys. And if you see the blood flow, the liver, the brain, these are larger organs in the body, but still your kidneys will have much more blood flow than liver, brain, or any other organ in the body. So the kidneys are the organs which get the largest blood flow per minute. Yeah. So is it better now? Or?
Yes.
Yeah. So kidneys get the largest amount of blood, and you would be astonished to know that we have 4 liters of blood in our body, and every 1 minute the whole 4 liters will pass through your kidney at least twice. So 8 liters of blood will flow through your kidney every 1 hour. So that's a huge amount of blood flow in the kidneys every minute, every hour, and that's how important the kidneys are. The kidneys do very important functions of filtering the body, filtering the waste products of the body. We have 2 kidneys, and each kidney weighs around 75 grams. Some people at birth, they are born with 1 kidney. So does that mean that they have got less renal function? No, because our body is made in such a way that if you are born with 1 kidney, the other kidney grows to the size of 2 kidneys combined. So if you are born with 1 kidney, that 1 kidney itself will weigh 150 grams. So it will compensate for the loss of the other kidney. On the other hand, if suppose you are born with 2 kidneys, but at some point you develop a kidney stone or a kidney tumor, or for any other reason your 1 kidney is being removed, you are left with 1 kidney now, that remaining kidney will increase its function. It will grow to at least 25% more. So from 50% it becomes 75%, and that is enough to filter the whole blood in the body and maintains normal renal function or normal kidney function for that patient throughout his life. So losing a kidney or being born with one kidney does not mean that you are going to develop a kidney disease. You only require to be under a follow-up of a doctor. Each kidneys have got small filtering units. They are called small filters. So each kidney, overall they will be filtering the blood, and inside each kidney you will have very small filters which are called nephrons, and each kidney will have around 1 to 2 million nephrons, that is around 10 lakh nephrons in each kidney. And if you take out those nephrons and you place it side by side, you will have at least 8 kilometers or 10 kilometers long nephron. So that's how densely packed they are in the kidneys, and combined they do the function of the filtration in the body. So now we come to the basic functions of the kidney. The kidneys will, the most important function is the filtering of the waste products. So whatever we eat, whatever acid is generated in the body, whatever waste is generated in the body by digestion, by the hormonal waste, the protein waste, whatever is there, that is all filtered through the kidney in the form of urine. It is mixed in the urine, and the other function is to excrete the large excess amount of water that we have in the body. So if you drink more water, more urine will come out. If you drink less water, less urine will come out. So the kidneys, they regulate the amount of water in the body, and they also regulate the amount of waste product in the body. Some of the important waste product which you can measure is urea, creatinine, which is easily measurable in the laboratory. So normally this level of urea and creatinine in the blood is very low, or it is less than, the creatinine is less than 1, the urea is less than 30, because that is being continuously filtered in the urine. So if you have a problem in the kidney, the first thing which will happen is the urea and creatinine will go up, because that waste product will stop getting excreted in the urine and it will start building up in the blood. The other important function is to maintain the sodium and potassium in the body. So sodium and potassium are some electrolytes which are present, and it can be measured in the laboratory, and these become abnormal when there is a problem in the kidney. Third is acid excretion. So our body by nature is a little alkaline. If the body acid levels increase, then the body starts behaving in an abnormal way. You start having breathing difficulty, you have a cardiac abnormality. So this acid level is maintained by the kidney, and excess of acid is excreted in the kidney. That is why when you have a kidney problem, they advise you to take less of animal protein, because more animal protein means more of acid excretion build up in the body, and that can hamper, and that cannot be handled by a failing kidney, and you can have symptoms. Then there are some very important hormones which are being generated by the kidneys. So some of the important hormones are renin, which is very important to maintain your blood pressure. So if suppose somebody is having a wide fluctuation of blood pressure, sometimes it's very high, sometimes it's very low, or sometimes you are having a difficult blood pressure, that means your blood pressure is not getting controlled, then even that can be a sign and symptom of kidney problem, because the hormone which is important to regulate that blood pressure comes from the kidney. Then there is vitamin D, an active form of vitamin D which is formed in the kidney. That means if your kidneys are not functioning properly, your vitamin D levels will be very low by nature, and you need to keep replacing that vitamin D. Your bones will become weak, you will have bone pains. Then there is a very important hormone called erythropoietin. So erythropoietin is a hormone which is required to maintain blood in the body. So if suppose somebody is having a blood deficiency, a low hemoglobin, that is called anemia. So again, anemia becomes a very important symptom, because you can have a most common cause of anemia is iron deficiency or B12 deficiency. So whenever you go to a doctor and your hemoglobin is very low, he'll give you some iron or vitamin B12. But one of the other important cause is a kidney problem. So if you have taken iron, you have taken B12, you have taken folic acid, still your hemoglobin is not building up, then that is a point where you should check your kidney functions, because if your kidneys are not functioning properly, this erythropoietin hormone will not be there, and because of the deficiency of erythropoietin hormone, you will have a low hemoglobin. So that is how we correlate all the functions to the symptoms of the kidney problem. So each of this function becomes abnormal when you have a kidney problem. So water regulation becomes abnormal, you won't be able to excrete the water, that water will get built up in the body and you will start having swelling of the body. So your legs will get swollen, your eyes will get swollen, your backside will get swollen. So swelling of the body is a very important symptom of kidney failure. So now we come to what are the early signs and symptoms of kidney problem. How do you identify that you might be having a kidney problem? So the problem with a kidney failure is that in very early stages you will not have any symptoms or signs. There is absolutely no symptom, no sign when there is a very early kidney problem. So we can't rely on sign and symptom to alert us that we are having a kidney problem. The only way you can catch it is by doing a regular monitoring, by doing a regular blood test, which is urea, creatinine and protein in urine, which is called albumin creatinine ratio, urine albumin, urine microalbumin. So very early kidney problem, you will have protein leakage in the urine, the protein will start leaking out from the body and your creatinine and urea will become high. That's the only way you can pick it up. Now say suppose you already know that you have a kidney problem, then we go to how we prevent from the creatinine to go up, that we will discuss later. Now say suppose you have not done the test and you are just starting to develop some symptoms. What are the symptoms which can alert you? So like we discussed, one of the important symptom is swelling of the body. Your legs will get swollen. There is pitting edema. Pitting edema means if you press the leg and you leave it, there will be a gap here, there will be a dip, that is called a pitting edema. You can check it in your leg, press for 10 seconds, 15 seconds, leave it and there will be a bump. So that is called pitting edema. Second, you will have swelling, like when you get up in the morning you will have periorbital swelling, your surrounding of the eyes will get swollen and that is all water. Second is urine problems. Sometimes you can have very high urine output, that means you will pass urine some 5-6 times, 8 times and the volume of urine will be very high, that is called polyuria. Sometimes you will have nocturia, that means you will have more urine in the night, you will get up to pass urine 4-5 times in the night. That should alert you that there might be something wrong. Most common cause is a prostate problem, but even otherwise in early kidney problem you can have nocturia. Third is you can have less urine output, that means you were passing 1 to 2 liters of urine in a day, which is a normal urine. Suddenly you will notice that you have started having only 500 ml, 600 ml of urine per day, which is very dark colored. Along with less urine output, you have started developing swelling of the legs, of the eyes, so that should alert you. Sometimes you will have a discoloration of the urine, you may have blood in urine, you may have very reddish, yellowish urine, which is a dark colored urine. Sometimes some drugs can cause urine abnormality, like if you are on TB drugs, you are taking some tubercular drugs, that drugs can cause a orangish urine, you should not worry about that, but commonly you will have very yellow, very darkish color urine, sometimes blood in urine. Sometimes the color may become odd, you can get a fishy smell, so especially diabetic patients with urine infections, you can have a fishy odor of the urine. You can have very foul smelly urine if you are having a very complicated urine infection. You will have very foul smelling, even pus discharge through the urine. Then because of the low hemoglobin, you will feel very fatigued, you will feel very weak, you will not feel like doing anything, you are feeling lethargic, you will feel sleepy all the time. If you walk to a certain distance, you will start having breathing difficulty. These are the problems which are associated with low hemoglobin and some excess water in the body. Thirdly, you will have bone pains because of that hormone we discussed, vitamin D hormone and parathormone level abnormalities. You will have very weak bones, and weak bones will cause generalized bone pains. You will have back pain, you will have leg pain, you will have severe leg cramps. So these are again some very subtle signs that you may be having a kidney problem. Now in the very late stages, say CKD, in a kidney failure, the staging is stage 1, 2, 3, 4, 5. So 1, 2 is early stage and 3, 4, 5, especially 4 and 5 are late stages. Your doctor will categorize what stage you are having, which stage of kidney problem are you in, and especially in very late stages, say stage 4 and 5, and when you are about to reach the stage of dialysis or transplant, you should be on the lookout for some uremic symptoms. So gradually what happens is this waste product starts building up in the body, and they build up to such an extent that it starts affecting every other organ in the body. So your urea and creatinine may become more than, say your creatinine is more than 5, 6, 7, and at that point you will start having abnormality of all the other organs, say your brain, your heart, your liver, skin, stomach. So each organ will have its own symptoms. So if your brain gets affected, you will have loss of sleep, you will feel sleepy in the daytime, you will become altered, so you will not be able to recognize people. So if you have a family member who is having a kidney problem for many years, and now he has suddenly started behaving abnormally, you should take him to the doctor immediately. Probably he requires some urgent attention. His breathing, he might have breathing difficulty, he might have itching. Very severe itching is a very important sign. You will have recurrent hiccups, you will have loss of appetite, you will not feel like eating anything. You will have say your pericarditis, you will have chest pain, you will have both the lungs not functioning properly, your heart functions deteriorate, you will have, so you need a regular cardiac monitoring, a regular checkup with your nephrologist to see how the kidney functions are progressing. So these are in a nutshell what symptoms you may have of kidney problem. So now we come to we have some questions which are already coming. We'll take up the questions in a bit. So now the important so I'll just take this first question. This is wishing you the best regards on World Kidney Day by Veda, Preeti and Mary. And Preeti asks, what are the early signs of kidney disease? What do we do when a person is both diabetic and hypertensive? So the first part of the question we have already addressed as to what are the early signs and symptoms. Like I said, very early there is no signs, no symptoms. So the only way is regular checkup, but later on in the disease, CKD stage 3, 4, 5, you will have these symptoms which we just discussed. What do we do when the person is both diabetic and hypertensive? So very nice question, because these are the group of patients who are the most at risk of having a kidney problem. Diabetics and hypertensive, when they stay diabetic and hypertensive for a long period of time, especially if it is uncontrolled, your HbA1c level is more than 7, your BP is more than 140 by 90. What happens is it slowly and steadily keeps damaging the kidney from inside, and you will have a protein leakage in the urine, and eventually all these signs and symptoms develop. So the problem in CKD, chronic kidney disease, is that once the problem happens, you can't do much to reverse it. So the best way is to prevent the damage from happening, and the best prevention is to control sugar and pressure as strictly as possible. So many a times we will see patients who come with diabetes with a very uncontrolled sugar, and they are very casual about it, that we are unable to control our sugar. But you have to understand that this casualness may land you up in a kidney problem, which later on you can't do anything to reverse it. Even if you control your sugar later on, your kidney problem is not going to reverse. So number one is prevention. You always control your sugar and pressure, and for diabetics and hypertensives, the number one advice I can give is yearly get your urine protein checked, urea creatinine checked. So ask your diabetologist or ask your cardiologist to advise you, or even by yourself, check urea creatinine and urine albumin every year without fail, because if you are checking yearly, you can pick up this early problem, and then you can start by meeting a nephrologist, and you can start the ways how you can delay the progression. So that brings me to the important question which Mr. Devojit has asked. What medications are available to keep kidney disease from getting worse? So that means he is asking how we can prevent the kidney disease from worsening, or how we can decrease our creatinine level, or how we can prevent from going to dialysis and transplant. So there is no single medicine, there is no magic medicine, or there is no alternate medicine. Many patients come to me with alternate medications like Ayurvedics, herbals, and recently there has been much talk about some water bath and all these alternate forms of therapy. So let me make it very clear that there is no form of therapy, or there is no medication as such which can bring down your creatinine or make your creatinine better or prevent you from dialysis. So it's a combination of multiple things. Number one, control your sugar. Number two, control your BP. BP should be below 130 by 80. Number three, control your uric acid. So again, you need a tablet to bring down your uric acid. Number three, control your weight. If you're very obese, very overweight, you need to bring down your weight. Number four, control your water intake and control your diet. So again, there is a lot of myth about water and diet, so we'll come to that a little later. But controlling your water intake and diet is again very important. Number five, there are some 2 or 3 medications like sodium bicarbonate, which has been shown that it decreases the progression of kidney failure, and there are some other additional drugs which can be given to control your creatinine, and you need to be on a regular follow-up with a doctor to monitor the progression. Mr. Aditya asks, nowadays why are children developing kidney disease at a young age? So this is again a very important question. Yes, we have seen many young children coming to us with kidney failure, and the most common cause of kidney problem in a very young child, say less than 20 years of age, at age 15, 16 or 10 or 8, is mostly a congenital disease. That means they are born with a problem of the kidney, ureter or bladder, and that problem slowly aggravates and becomes a full-fledged kidney failure. That is called a CACUT, a congenital anomaly of the kidney and urinary tract. That is generally identified at a very young age, and under expert care we can prevent the kidneys from failing. Number two reason in such patients is a glomerulonephritis. That means there is a body reaction against the kidneys. So it may be a SLE, it may be some other IgA nephropathy, membranous nephropathy, FSGS, nephrotic syndromes. So these are glomerulopathies which affect the kidney, and they cause, if not managed properly, they land up in kidney failure at some point or the other. So these glomerulopathies or nephrotic syndromes or nephritic syndromes, they require some special drugs called immunosuppression. That means they require drugs like steroids, cyclophosphamide, mycophenolate, which are very advanced drugs to suppress your immunity. So that brings down the immunity and prevents and helps you to control the disease. But the side effects are that you may have infections and you may have some other complications. So it has to be balanced, and you have to be under an expert care. But yes, medications are available for that. And number three, nowadays we are seeing a lot of young people coming with diabetes and kidney problems. So even patients who are 23, 24, 27, 30, they come with diabetes which was diagnosed early because of the lifestyle we are leading right now, because of some genetic problems like their father and mother both were diabetic. Now they develop diabetes at a very young age, especially children who are obese, not having a control on their diet, and then they go on to develop a kidney problem. So these are the common reasons why children develop kidney problem. But in children, most of the things can be delayed if they can be managed properly. The problem is the awareness about kidney disease in children is very low. We don't expect the children to land up with an advanced kidney problem, and that is why we are not very alert towards their symptoms. So we need to keep a watch. We need to get them checked on a periodic basis, and any symptoms you identify, get them to an expert. Here I have another question which is being asked by Varsha, and she asks, what age is appropriate for kidney transplant, and when is transplant recommended, and is it better than dialysis? So this is a very good question. So let me tell you something about transplant. See, once the kidney problem worsens and you land up in CKD stage 5, the only option you have is a dialysis and a transplant. There are no other options available. There is no alternate medicines available. So very interesting fact about transplant is that the first transplant in fact was in the world, the first transplant was done in 1933, and you would be surprised to know that it was done in this small country called Ukraine, which is under this big crisis right now. And the doctors there attempted the first human kidney transplant. Unfortunately, that transplant was a failure, but it was a success in terms that it led other people to think in this line, and ultimately a successful kidney transplant was done in the year of 1954 in America. And in India, the first transplant was done at CMC Vellore It was done in the 1970s, and then consequently PGI Chandigarh did the transplant, and we at Excelcare, Apollo Excelcare, we did our first kidney transplant in 2020. The date was 21st December, a very proud day for us. So the transplant program is something which every patient should be made aware of, because when you compare transplant to dialysis, transplant is any day better than a dialysis. So if you are a candidate who can undergo a transplant, so there are some patients who absolutely can't have a transplant. Say if your age is above 70, you are having any other problem like cancer anywhere else in the body, your cardiac functions are very poor, or you are having a kidney abnormality which prevents you from going to a transplant, then or your age is too young to go for a transplant, then it's a different issue. But otherwise any patient can go for a transplant if they have an eligible donor. And the benefits of transplant are multitude. Like you can prolong the patient's life. The average life on a dialysis is around 5 years, but on a transplant you can prolong that life. Your quality of life is much better. In dialysis you have to go for dialysis twice weekly, thrice weekly, every time, but transplant gives you that freedom and makes you normal again, so that you can return to your normal routine, just keeping well with some medications which you are required lifelong. Now she asked, what is the age which is appropriate for kidney transplant? So see, a transplant can be done from a child who is weighing anywhere more than 18 to 20 kgs. So even for a child who is less than 20 kgs, it has been done, but ideally if the weight is more than 20 kg, he can go for a transplant. And on the other side, a patient who is less than 70, ideally less than 65, but we can stretch it up to 70. Anybody who is less than 70, we can go evaluate them for a transplant, provided their general health is good and their cardiac function and liver function is good, so that they can withstand the surgery. And when is transplant recommended, she asks. So once you start dialysis, so if you have reached CKD stage 5, how do you know you have reached CKD stage 5? That is again based on creatinine. So you check the creatinine, and there are multiple softwares available on the internet which are called GFR calculators, that is glomerular filtration rate calculators, and you put your creatinine, age, weight, height, all these parameters, and you will get the GFR. If your GFR is less than 15, you are CKD stage 5, and if your GFR is less than 10, then you are an eligible patient for transplant. So that is when we recommend transplant. So we have another question coming in from Riya Chakravarti, and she asks asking advice for precautionary measure to be taken in advance. So her question is very relevant to the theme we have this year, which is kidney health for all. So she is asking what precautionary measures we all can take to prevent from the kidney disease from happening. So number one advice, drink a lot of water. In a healthy kidney, keep it filtering well, keep it hydrated so you do not have formation of stones. That is the number one advice. Number two, avoid any out of the prescription drugs. So many a times what happens is we have a fever, we have headache, we have sneezing, we have cold, we go to the counter, we take the pharmacist advice and we take some drugs, we take painkillers, we take other medications. So this should be avoided. Avoid alternate medications as much as possible. So you will see many promotions for immunity boosters, health boosters. So in conventional science, in the modern era, very few medications have been shown to improve your immunity, or we have medications which can suppress your immunity, which are used in transplant, but medications which boost your immunity are really not that effective. So take good diet, but avoid any kind of supplements as much as possible unless it is prescribed by a doctor. Number three, if you are a diabetic, if you are a high risk person, say suppose you have diabetes, you have hypertension, you are a cardiac patient, or you are a patient who is suffering from any other chronic disease like a hematological problem like a long-term anemia or any cancer. So these kind of patients, you should check your kidneys periodically. So for a normal person, you get your kidney checked, like urea, creatinine, albumin in the urine, you get it checked once, and then maybe every 2-3 years you can do a preventive checkup. But for these high risk patients, every 8 months, 6 months to 1 year, you should get your kidneys checked, because if you can identify it early, then we can give you medicines to prolong that disease and not allow you to go to a dialysis or a transplant stage for as long as we can. So we have some other questions. Mr. Dhrubajit Das, he asks, can uric acid also cause kidney problem? Yes, recently the research has shown that very high uric acid levels, if it doesn't get if you don't control it and you allow it to stay high for a long period of time, you may develop a kidney problem which is called urate nephropathy. That means uric acid depositing in the kidney causing a kidney problem. So uric acid control is important. Number one is diet control. Avoid animal protein. Go for more of plant based proteins like paneer, soya and all the other dals and all such things. Avoid red meat, avoid heavy chicken intake. Control the uric acid. Even if that is not working, take a lot of water, take help of some specialist to give you some medicines to decrease the uric acid, and that should prevent the kidney problem. Mr. Joy has asked, any particular diet to control creatinine level or avoid certain foods? Yes, there are certain diets. Number one diet advice is that avoid animal proteins as much as possible. That does not mean that you should absolutely stop protein intake. Say if you are a 60 kg person, 0.8 gram per kg, that means around 50 grams of protein should be taken, otherwise you will lose weight, you will lose your muscle mass, you will become weak. So take 50 grams of protein at least, but that protein should be majorly a plant based protein. Avoid as much as possible animal based protein. You can take fish once in a while, you can take chicken once in a while, you can take egg whites, but avoid red meat, avoid heavy meat intake on a daily basis. That is number one, because that makes your blood acidic, and acidic blood is known to cause a high creatinine level. Number two, avoid fruit and fruit juices in advanced CKD stage. So say if you are CKD stage 4 or 5, your potassium levels in the blood can become very high. So avoid fruits which are high in potassium. The 4 fruits which are very safe is apple, papaya, guava and naspati, and to some extent pineapple. So these 5 fruits can be taken by a kidney patient. Other fruits you generally tend to avoid. Number 3, salt. So you need to take less salt, and nowadays there are some special salts available called Lona salt, low sodium salt. So these salts, they have got low sodium but they have got high potassium. So in a advanced CKD, in CKD stage 4 and 5, this high potassium may become a problem. So take a normal salt, the normal Tata iodized salt or any of those salts, but take in less quantity. Mr. Alok Mandal, now he asks, how much BP is suitable for a transplant patient? So that's again a very good question. In a transplant patient or any other kidney patient, your BP should be below 130 and 80. So the systolic pressure, that is the higher blood pressure, should be below 130 and the lower pressure should be below 80. That's the suitable range to prevent the kidney problem from worsening. Miss Mary asks, for diabetic patients, how frequently do kidney screening or blood tests? So this we have discussed that for any high risk patient who is having a chronic kidney problem, yearly checkup is very important. Yearly blood test should be done, yearly urine test should be done. And which tests are recommended as a routine? That is urea, creatinine, and if you want we can do a sodium potassium, but a urea and creatinine is very basic, and a urine protein test, that is a microalbumin test. In some labs it is also called as a urine albumin creatinine ratio, that has to be done by all patients. So we have another one question coming in. So this, Kanakji has asked, do skin medicines increase creatinine or cause kidney damage? So again, this is a very interesting question. See, most skin medicines can be classified as 2 types of medicine. One is the medicine which you apply on the skin, and another is the medicine which you intake for a skin problem. So most of the medicines which you apply on the skin do not get absorbed in the body and thus will not cause much of a kidney problem. But for some diseases, for some skin diseases, you might require to take some medicines. So those medicines, like sometimes you are prescribed steroids, sometimes you are prescribed some immunosuppressive drugs like tacrolimus, those medicines sometimes can cause a kidney problem. So you have to discuss with if you are already having a kidney problem, you need to make your skin doctor aware that you have a kidney problem, so that he can prescribe you drugs which do not affect the kidney function. If you are not having a kidney problem, then most of the 99% of the skin medicines will not cause much harm, unless it's a very strong immunosuppressive medication which can affect the kidney functions. If you are taking it for a long duration, I suggest you get your urea creat, urine protein checked once in every, say, 3-4 months. So I think that brings us, we are almost 30 minutes into this live session. So it has been a very interesting session for me, very relevant questions coming through. So we'll be closing this session now, and I hope we can continue this kind of educative sessions in the future, so that all the listeners can interact with us and get their queries solved. So this is Dr. Karan Saraf, nephrologist and transplant physician at Apollo Excelcare Hospitals, and thank you so much for tuning in, and a very happy World Kidney Day to you all, and I'm always available for any kind of help you want to reach out to. Thank you.